This meeting is, for me, something very special. It's like a family meeting, one of the smaller meetings, but that's also the family approach to things. And I almost know almost everybody here personally, and so it's like coming together for Christmas or Easter.
Yeah, this is the 8th meeting, and it's very educational. Faculty are, most of them are world experts, and very well selected subjects of the meetings, and they were very able to gather experts and professors from different parts, and it's truly international, and I am proud to be there with them.
So you arrived before Biden, because in 1 month it will be NATO summit.
First of all, this kind of meeting is very useful and even necessary. This is a kind of summary of current guidelines and routine practice. This is a good forum for sharing the experiences and exchanging the knowledge. Intensive care treatment and emergency medicine is a very big challenge for societies for nowadays.
We need the patients to come to us early, because I come from the Middle East, where patients, we are having like epidemic of coronary heart disease, but unfortunately because of the risk factors, they are not very well controlled. Still we have smokers, we have diabetes, hypertension, and so we reach half of the patients, they arrive already with heart attacks, where they already had complications, they have multiple coronary lesions. We will be very much achieving if we reach these patients before they have the heart attacks.
Yeah, this is actually the first time to be here, and I'm really enjoying it. It's not only the nice weather, it's a nice city. There are a lot of friends here, and I appreciate to be part of this great meeting.
Pleasure to see you all here, and also the people out in Cyberland. I'm going to talk to you this morning about a science that doesn't get talked about very much, and that's demography. The final message, of course, is that the United States has many Lithuanian. We have to convince the government that it's time to try and bring some Lithuanians home again.
And the other thing I really like this meeting is that there is a great interaction between the physicians, and they're really talking about medical science. Where you go to a lot of American, like for example, American Heart Association meeting, a lot of good medical science does not get talked. So, you can pick and choose, where here we can just concentrate and listen to everybody's medical science research they've done. So,
professors and young professionals session where you can ask anything, career advice, life advice, how you do it, how did you do it, and what would you recommend for young people to do?
Feeling that the things I do are useless, which may be the case in other professions. You wake up someday after 10 years and tell me, what am I doing now? That's not really happened to anyone I know in medicine. That's a good career choice.
I adore cardiology. I am a cardiologist since many years. I organized tens of cardiology meetings in Egypt, and I'm part of the American Society of Cardiovascular Geography. Cardiology is the most important thing because it's life-saving, and the most important mission for us is education and to raise generations of cardiologists who can take care of the patients, and they raise the flag of science.
is humbling because research has taught us a lot. We have preconceptions of things. We have concepts that come from studies or things that we learned. And when we challenge those concepts, when we test those concepts in a systematic way with the scientific method, sometimes we confirm them or we reject them or we find new ideas. And I think is crucial in order to be able to provide, the main goal is to provide best care to the patients.
Between medicine, literature and art, it's art of life, it's humanity. It is not only, we are not only to stent patients, just put stents, we are clinicians and we are human beings. It should be like this. It is not like, we are not angels, we are trying to serve the patients, but we should not only concentrate on strict things. We are not mechanics, we are clinicians.
Who died, yeah. And I was really glad I'm not in that position, because when somebody dies in my department, these are some 84-year-olds, yeah, and sometimes you made a mistake, yes, and this might be partly also responsible for the death, but still it's a different scenario than a young child. So, and you probably have to decide up front if you can cope with such things, because it will happen and you will feel guilty.
The thing is just one goal is to get good young doctors, to train them. That's the most important thing, because we all are getting older. You're young now, but I'm older than you, and I want good doctors to treat me when I'm maybe 70 or 80 years old. So the thing is just we have to train our young doctors in a very good way. The biggest struggle that we don't have enough doctors. We need more doctors. So come and go for cardiology.